Hey guys, okay, let's now take a look at the respiratory system. So the last chapter we're going to look at this week. So in the respiratory system, so you guys are already probably pretty familiar with how the respiratory system works. This is where we're going to focus on the process of breathing air in and breathing air out. As again, when we talked about the respiratory system, when we talked about the circulatory system, we talked about blood. Remember, we stressed how important it is for oxygen to get to all of our tissues. Well, in this chapter, we're going to take a look at how that oxygen gets to the blood so that the blood can do that part. So in this chapter, we're going to look at a couple things. We're going to look at the structure and functions of the organs of the respiratory system, and that's pretty much going to be our main focus on this chapter. We're going to look at the anatomy of the respiratory system. I do have a diagram for you guys to follow along with me in this video, so you guys will see that. So we'll talk about how air moves from the nostrils to how we breathe that in, all the way to what's called the alveoli in our lungs. So I'll explain that, and it's the alveoli that will then pass on that oxygen into our blood capillaries. So that's kind of the end stage of respiration. So we'll follow that entire pathway. We'll take a look at why lungs collapse or expand. So we'll talk about that, the process, and then we'll get into the role of pulmonary surfactants a little bit. We'll talk about how that aids in that process. So I'll explain that. So you guys have probably many times heard of the respiratory tract being referred to as either the upper respiratory tract or the lower respiratory tract. The upper respiratory tract is everything above the chest. So really, as it mentions, they're outside the chest. So as you can see in this diagram here, we're talking about the nose, the throat, right up to the top of the trachea, really. Whereas lower respiratory tract will be everything beneath that. So including the lungs and everything within the lungs as well. So that is your respiratory system. Most of the time we hear this because we oftentimes refer to this when we're talking about infections. Somebody who has an upper respiratory tract infection may be experiencing some type of sinus infection or perhaps even strep throat, whereas a lower respiratory tract infection means it's a little bit more severe because it's gone beyond the upper respiratory tract. It means that pathogen has followed that pathway down the trachea and has now made its way deeper in, and closer to the lungs, if not in the lungs. So things like bronchitis or even pneumonia are pretty serious respiratory tract infections because they are affecting the lower respiratory tract. Okay, so here's the diagram. Here's the labeling sheet I have for you guys for this chapter. Looks pretty intense, but I'm going to go ahead and walk you guys through this one first. There is a diagram in your book on page 404 that maybe not as detailed as this one, but we're going to discuss all of the different parts as we go through the rest of this chapter. So everything that's on this diagram is discussed somewhere in the PowerPoint. So I want you guys to just see where that is first before we start discussing it, so you know what I'm talking about and can get a visual of that when we get to that stage in the lecture. So starting with number one up here at the top, you can see is just pointing to this guy's nose. So we're looking at number one is just the nose. We're starting with the process of breathing air in. So inspiration just takes place. We know we can breathe air in through the nose or the mouth, but mostly we inhale through the nose. So we're going to start here at the nose. We'll talk about where the respiratory tract can meet up with the mouth so that that air coming in from the mouth will also get to our lungs as well. So from there, so we just called that our nose. Air is going to be inhaled in through the nostrils of our nose. Also, you may see that sometimes referred to as our nares of our nose. Those are the openings in our nose. Air will then travel directly into our nasal cavity. Number two is simply just pointing to the nasal cavity. We'll talk about this in the PowerPoint today too, and we'll talk about how the importance of that mucous membrane inside the nasal cavity helps to trap debris, with the addition of what I'm going to label for you guys here in number three, helps to warm and moisten air as air passes into our respiratory system. So number two is the nasal cavity. Number 3 is pointing to what you guys may see as what's called the paranasal sinuses. But if you just call those your sinuses, that is totally fine. We talked a little bit about the sinuses when we talked about bones, because sinuses are simply just cavities contained in our skull. So one, they help to lighten the load of our head. It helps to lighten the weight of that skull. But like I mentioned, in combination with the nasal cavity here, it's going to help to warm and moisten that air as it then passes into the rest of our respiratory tract. So that is the sinuses. Now, the next part that we're going to identify is called the pharynx, which is commonly referred to as our throat. So you can see it labeled in your all's diagram on your book. It's called the pharynx. So but before you guys label this just yet, because there's different sections of the pharynx. It says PHARYNX. And the reason why I stress that is because, and I'm just going to grab something here, I oftentimes see that pharynx and larynx are oftentimes misspelled because we commonly want to say nix, like NYX. But pronouncing that, we think about that as pharynx is a way to kind of think about that. I wish I had a marker so I could spell that here for you. No worries here, but so that's how we would see that as pharynx. But there's 3 different sections of the pharynx, and that's actually what numbers 4, 6, and 8 are pointing to. And we again are going to identify all 3 of these sections throughout the PowerPoint. It's just labeled as your pharynx on that diagram, but you will see the different terms in the paragraph on page 405 where we talk about the pharynx, where you can see these different terms. But I'll spell them out for you guys too. That's why I'm looking for a whiteboard here, a dry erase marker here so I can write these out for you guys. I'm sorry that I didn't think about that before I started this lecture here. Okay, but that, like I said, I can just spell those out for you guys. So number 4, so again, everything is the pharynx. PHARYNX. So that's the pharynx. Everything is going to end with that term. Sorry if you guys can't see that. But the difference between the 3 different levels of the pharynx is where they're located. So for instance, number 4, you put just the prefix NASO in front of that, and that is referred to as the, sorry if you can't see that, that's NASO, the nasopharynx. Sorry, this marker's terrible. The only markers I have in my office are really old. Oh, that's a good one. Okay, the next section of the pharynx is actually what number 6 is pointing to. As you can see, numbers 5 and 7 are actually pointing to those green little masses. Hopefully those are something that we're already familiar with because we talked a little bit about these in the previous chapters. Those are your tonsils, and we'll talk about those here in just a second. But for now, let's label these different sections of the pharynx. The next section in number 6, so that was number 4, the nasopharynx. Number 6 is ORO in front of the word pharynx. Oropharynx. I always think about that as it's directly behind the oral cavity. So that's my way of remembering that that's the oropharynx. All right, and like I said, 5 and 7 we'll come right back to. But number 8, over on the other side, you can see it actually sits right on top of what number 9 is going to be called the larynx, which is our voice box. So because the last part of the pharynx sits right on top of the larynx, that's what that prefix is given there. So that we're going to have the prefix, I always pronounce it as laryngopharynx. So it's LARYNGO. Sorry, I tried to put that in there. LARYNGO, laryngopharynx, because it sits right on top of the larynx. And that was number 8 on your diagram. Just so you guys know what those are. Those are all, as you guys can see, all end in the word pharynx. There's no spaces between. It's just the prefix in front of that. Nasopharynx, oropharynx, and laryngopharynx. Those are all the different names to the, and like I said, we'll see that in the PowerPoint as we go through the rest of this here, so you'll get to see that spelling again. So I mentioned number 5 and 7 are masses of lymphoid tissue that are right there, right behind the nose, right behind the mouth, ready to protect should we need that. So number 5 Both of these are typically referred to as the tonsils. Number 5 are your pharyngeal tonsils, and number 7 are your palatine tonsils. But the pharyngeal tonsils are sometimes referred to as adenoids. So if you guys want to just label those as the adenoids, that would be totally fine too. So number 5 is pointing to the adenoids. Well, now I'm lost this marker. Adenoids. I'm trying to spell this out for you. ADENOIDS, adenoids. That's just a common term for those particular pharyngeal tonsils. If you labeled those as pharyngeal tonsils too, that's totally fine. I think, in fact, that's how we identified the tonsils in our previous chapter. Whereas number 7, commonly referred to as the pharyngeal tonsils, but because these are what we typically refer to as simply just the tonsils, I'm okay with you guys just calling those tonsils, especially if you're labeling number 5 as the adenoids. These guys are the ones that are typically removed during a tonsillectomy, should we see some infection of the throat there, with, like I said, with typically in children. So those you can just label as tonsils. But if you are labeling number 5 as the pharyngeal tonsils, I do want you guys to tell me the difference between the two. Number 7 are the palatine tonsils. So hopefully that's a refresher from our previous chapter. Okay. All right. So number 9, I mentioned that 8 is the last part of the pharynx, called the laryngopharynx, because it sits right on top of the larynx. So again, identified for you guys there on page 404, LARYNX. So remember, larynx. Our larynx is more commonly referred to us as the vocal cords, or voice box, I'm sorry. That is where your vocal cords are contained, which gives us the ability to speak and sing, and that's where that sound comes from, is our voice box. But again, officially named the larynx. Now, in this diagram, number 10 really has nothing to do with respiration. However, it is on this diagram for a very important purpose. That is because number 10 is our passageway for food. It is something we will talk about next class. It is the esophagus. The esophagus is really important in digestion. However, we point it out here because you can see it runs directly behind number 12, the trachea. So number 12 is our trachea, number 10 is our esophagus. The reason why we have this labeled here is because both air and food come in through our mouth. We can breathe air in through our mouth just the same way we can through our nose, and it should get to our lungs no problem, especially when our nasal passages are blocked due to some type of infection. It's really important that we still get air into our bodies. So how does our body know to differentiate between air and food and liquids? Because food and liquids are going to go down that esophagus, and then our air needs to go down the trachea. Well, that's where number 11 comes in. Number 11, right here, you can see it's pointing to this little bitty guy right here. It's actually just a flap of cartilage. It's just a piece of cartilage that actually acts as kind of like a trap door. In the event that we go through the swallowing motion, whether we are swallowing some type of liquid or food, or even if we just swallow spit right now, doing, not eating anything, but if we were to swallow spit, the swallowing motion here in our neck will actually force this piece of cartilage to kind of shut over top of the trachea for a brief second, so that way anything that we're swallowing can briefly pass over the trachea and go into the esophagus where I want it to go, and then make its way into the stomach for digestion. Whereas air, when that swallowing motion is not taking place, that epiglottis, oh, I'm sorry, I didn't tell you what it was. The epiglottis is what number 11 is. Epiglottis, E-P-I-G-L-O-T-T-I-S, the epiglottis. It will stay open for us while we're just sitting here breathing, not eating. And it's only a brief second that closes to allow that passageway of food, and then we'll open right back up. It is this guy that when you swallow or drink something too quickly, sometimes the epiglottis doesn't have a chance to make it over the top of the trachea, and sometimes we say that, you know, went down the wrong tube and it causes us to cough a whole bunch, and that is because liquids that go down our trachea, we're going to have a reflex because we want things out of our trachea, so we're going to cough that out of the trachea. So that is a true statement. It really did go down the wrong tube. It went down the trachea instead of the esophagus, and that is because the epiglottis didn't close in time. All right, so that was number 10 was the esophagus, number 11 was the epiglottis, and number 12 is our trachea. So our trachea passes through our chest, but it passes through the very center of our chest is given a specific name. That specific name is called the mediastinum. So M-E-D-I-A-S-T-I-N-U-M, the mediastinum. That's what number 13 is pointing to. The mediastinum, and that is simply just the center of the chest. You can see it's not necessarily pointing to a particular organ, but that is just the center of the chest area. So it's where the trachea passes through that chest. All right. Number 14 is where the trachea is going to branch off and enter into each lung, and that is referred to as the bronchi. So where those branch off, bronchi, B-R-O-N-C-H-I, bronchi. So we've got a left and right bronchi, so number 14 is pointing to both of them. So that's where the trachea branches off and goes into number 15. Number 15 is pointing to the lungs. It is specifically pointing to our right lung. As you can see, it's over there, but obviously we have two of those. So it is identifying just the lungs in general. All right, those are the lungs. So those bronchi enter into the lungs, and then they branch off and become smaller branches. And oftentimes you may hear the lower respiratory tract referred to as a bronchial tree. And that is pretty true, because if you look at it as the trachea is the trunk of the tree, and then, so it's kind of an upside down tree. Look at it as the trunk of the tree, the bronchi are the large branches. Those smaller branches are what number 16 is pointing to. Number 16 down here in this smaller picture is pointing to the bronchioles. So same term, bronchi, but add O-L-E-S at the end, bronchioles. So those are your smaller branches, and at the end of those branches, the leaves of our bronchial tree here, these small cluster, looks like a cluster of grapes, these are air sacs in our lungs. These are called the alveoli, A-L-V-E-O-L-I. I think it is. Well, I know we'll talk about it, but it looks like it's not identified for us. A-L-V-E-O-L-I, alveoli. If you're looking at just one of them, it's called an alveolus, but alveoli is plural for all of the ones that are in our lungs. These are the end point to respiration. What happens is we follow the pathway that air takes into the lungs. Once it reaches this alveolus, what we're going to see is air being pushed through these alveoli, and we'll go directly into, as you can see, surrounding each alveolus are some blood capillaries. And that's what number 18 is pointing to, is simply just pointing out a capillary. So again, we're familiar with capillaries. That's where our exchange will take place. And in that picture, you can see that exchange occurring. That oxygen is being delivered from the alveolus, that air that we just took in, oxygen is being pushed right into the blood, and then carbon dioxide is being pushed into the alveolus. That is because in the process of exhalation, we are going to breathe out that carbon dioxide, that waste gas. Oxygen is being picked up, carbon dioxide is going to be eliminated. And number 19 is simply just pointing to our red blood cells. So honestly, number 19, you could call that red blood cell, erythrocyte, or even you could even use the RBC abbreviation for red blood cell, and that would be fine too. But that's just showing that because, again, it's our red blood cells, remember, that are the ones responsible for carrying oxygen to the rest of our tissues. Okay. And then we get to numbers 20 and 21. I'll point that out to you guys before I just kind of refresh. Number 20 and 21 are both pointing to some protective membranes in our respiratory system here, referred to as pleura, and we have a whole slide dedicated to our pleura, so you'll see these. Number 20 is specifically pointing to the pleura, which is the membrane that lines the inner lining of our thoracic cavity, and that is called the parietal pleura. Whereas number 21 is pointing to the pleura, or the membrane that lines the lungs themselves. So the membrane, the parietal pleura, oh, sorry, and that's referred to as the visceral pleura. So visceral meaning pertaining to an organ. This is specifically the pleura on top of the organ. So when I say pleura, that's what I'm referring to, is a membrane. These pleura are actually going to produce a fluid called pleural fluid, which is going to provide a somewhat of a lubrication. In the process of breathing air in and out, our lungs are expanding and contracting and expanding and contracting. And so instead of the lung tissue itself being pushed up against the wall of our thoracic cage, instead it's these two membranes along with that fluid that those membranes produce that are going to help to ease that process and help to create less friction. And then number 22, there is a muscle underneath our lungs here that separates the thoracic and abdominal cavities. You may remember this term from day one. We talked about the diaphragm. So that is the diaphragm. And we'll see all of these terms as we go throughout the PowerPoint, but I just want to refresh your memory so far. We have looked at, air coming in through the nose, going directly into the nasal cavity, passing underneath the nasal sinuses. Remember, the two there are going to help to warm and moisten that air, as that is easier to process as we go into our respiratory tract here. It's going to then go into our throat, which we know as our pharynx, first passing through the nasopharynx, where then it's going to also run past those adenoids for protection. It's then going to go into the oropharynx, number 6, where it's also going to run past our tonsils. And then we're going to go, so that was number 7. And then we're going to go past, through the laryngopharynx right before we get to the larynx. So number 9 is the larynx. Before passing into the trachea, again, remember the reason why this is able to go through and not into the esophagus, because our body knows that anything going down this should, any air needs to go into the trachea. It's only food and liquids that will go into the esophagus. So in the event of swallowing, the epiglottis, number 11, will shut on top of that trachea, making sure food and liquids can go into our esophagus, number 10. So then air will pass through the trachea, going again in through the center of the chest, called the mediastinum, number 13. That will then branch off into each lung. We'll have air going into the left or to the right into the left lung here, because it will split off here at the bronchi. It will then branch further into those bronchioles, number 16. And the ends of each bronchiole, we have alveoli. Remember, that's the air sac of our lung. The alveoli, once that air reaches the alveolus, it will push up against the wall of the alveolus, forcing oxygen out of the alveolus and into our capillaries. So capillaries here in number 18. Being picked up by our red blood cells in number 19, and now that oxygen is on its way first to our heart to be pumped through the heart, and then we know to the rest of our tissues where they can utilize that oxygen to function properly. Again, that air has processing of oxygen has created a chemical waste called carbon dioxide, abbreviated there as CO2, so that CO2 is now being pushed into the alveolus so that we can exhale that carbon dioxide. To help protect the lungs during breathing, we have our parietal pleura in number 20 and our visceral pleura in number 21. And the muscle that helps in that process of breathing, we're going to see the diaphragm in number 22. Okay, so that is our labeling for this chapter. I wanted you guys to see that and to hear a little bit about how air is processed. Is it, what are some of the things that some of those parts do? And we're going to talk about each of these. So again, the upper respiratory tract will consist of the nose and the nasal cavities. So again, 1 and 2. We get into the pharynx. Remember, we labeled 4, 6, and 8 as the nasopharynx, oropharynx, and then the laryngopharynx. As it passes through, we commonly refer to that as our throat. From there, we will get into the larynx. The larynx contains our vocal cords, so that is why our larynx is oftentimes referred to as our voice box. And then we went into our trachea, number 12. Our trachea is made up, will always, unless of course there's some type of damage done to it, but this is typically standing wide open because it is made up of cartilaginous rings. So that cartilage is going to help to protect that and keep it open. It is not just made up of a thin, delicate membrane, because we don't want any blocking or, we don't want any damage done to it. So it's tough. It's got this cartilage that's going to help to keep it upright. So those rings, they're C-shaped rings that are all in a row that are going to help to keep that open. And that is our trachea. So what do these things do? So again, our nose and our nasal passages, and again, along with our sinuses will help with this, but it helps to warm and moisten as well as conduct that air. Our throat will help to conduct that air into our lower structures. So it's simply, these are just passageways to get to those lower structures. So the pharynx will then take that air and push it lower. Our voice box, or again, our larynx, will help to vibrate our vocal cords, which helps to produce sound and conduct air into those lower structures. So we'll pass through and get to the trachea. And the trachea, again, the trachea we commonly refer to as our windpipe. This conducts air into the right bronchus and the left bronchus. Remember, we labeled number 14 as the bronchi because bronchi is plural, because I'm pointing to the 2 of those. We've got one going into the left lung and one going into the right lung. So again, referred to as the left and right bronchus. Here just shows a side view of that pathway of our upper respiratory tract here. So just a different angle. I'm sure this picture is in your all's text too. Yes, on page 406. So you can see that, sagittal cut of our upper respiratory tract. There's our nose, nasal cavity, and there it's pointing out the naso, oro, and laryngopharynx, as well as our palatine tonsil and our pharyngeal tonsils up here. Again, they put it in parentheses and showed that they are also known as the adenoids. So if you guys want to identify that. And then that goes into, you can see here, here's our larynx. It also points out with the larynx the epiglottis. So you can see maybe a closer angle of that and how it's going to shut over top of that trachea as food and air can pass through. It also shows our vocal cords from here. You can now see it from an above angle. So, taking kind of a transverse cut of our voice box, you can look at it from that viewpoint and you can see how the glottis, what's inside the larynx there, can open and close, and it's those vocal cords that will vibrate that produces the sound that we create. They also have a different angle of our trachea there. The cartilage there of the thyroid is what actually creates that look of the Adam's apple, again, just larger in males. So that's what that looks like. But there's our trachea, and you can see the cartilaginous rings that we have in our trachea, and that's what, again, helps to keep that open so that air is constantly getting to our lungs. Then we have our lower respiratory system, and we've identified each of these. So we have our bronchi, number 14. We labeled number 16 as the bronchioles. We labeled number 17 as the alveoli. Number 15 is the lungs, because those are contained within the lungs. And then again, I mentioned that the pleura is the membranes that are protecting our lungs themselves, and the cavity between those 2 pleura are also going to be important. And we're going to talk about that in just a minute. Okay, so our bronchial tree. So again, our left and right bronchi also made up of cartilaginous rings, so we can keep it open. Don't worry about carnia, but I meant to take that out there. But they are going to, again, pass into, each lung. The bronchioles are, as we get a little bit smaller, those bronchioles are made up of mostly smooth muscles. So again, the contraction of that smooth muscle is also helping to push that air towards the alveoli. Whereas just like capillaries, alveoli are made up of a single layer membrane, because again, we want that, things to be able to get through, so that wind that's coming into our lungs there, we want air to be able to pass through the alveolus and into our blood vessels, into our capillaries. And that's what makes up our bronchial tree. So again, bronchi's job is to conduct air to the bronchioles. Once it reaches the bronchioles, then smooth muscle will determine that diameter, helps to open up and regulate the flow of air to the alveoli. And again, the alveoli, small grape-like structures, as I showed you guys in that picture, they're referred to as air sacs pretty often. And they're air sacs that exchange oxygen, abbreviated there as O2, and then CO2, which is carbon dioxide. And it helps to exchange that with our blood in that pulmonary circulation. Remember, we talked about pulmonary circulation when we talked about the circulatory system. That pulmonary circulation just meant that it's the exchange of oxygen and carbon dioxide within the lungs. And then we talked about how then it moves, so the exchange between lungs and heart, so that circulation then moving to the heart is part of that circulation. Okay. So oxygen will move from the alveoli. So this we've actually seen a picture of. This is just more of an explanation of this. Oxygen will move from the alveoli into those pulmonary capillaries, and then there they will make its way, in pulmonary circulation to the heart, where the heart will then pump it to the rest of our tissues. CO2 is also coming in from the pulmonary capillaries, being pushed into the alveoli, and then from there in exhalation, we are going to actually push it in the opposite direction. That air is going to go back through the bronchioles, through the bronchi, through the trachea. We're now just kind of moving up, going opposite of the way that they came, and that oxygen will then be exhaled out of our either nose or mouth. The lungs are large, soft, cone-shaped organs. They contain the structures of the lower respiratory tract. So again, we saw in that picture, so you can see your lungs on page 409, not your lungs, but a picture of lungs on page 409. But again, they contain those organs, so our bronchi and our bronchioles and alveoli. We refer to the top part as the apex. I don't think, maybe we did. In the heart, you may recall that the bottom part of the heart is referred to as the apex because it's the pointed part of the heart. In the lungs, the pointed part is actually at the top. So the top of it is referred to as the apex, at the top of each lung. And then the bottom is referred to as the base. And that makes sense because it's the bottom. Now, the right and left lung look a little bit different. The lungs are divided into different lobes, and I wouldn't really worry too much about the names of the lobes, although they're just named according to those directional terms. The top and the bottom we know as superior and inferior, but those different lobes, there's actually 3 lobes on the right lung and 2 lobes on the left. The reason why the left lung only has 2 lobes is because the positioning of the heart just tucked underneath that left lobe requires that lung to look that way, to only have those 2. And you can kind of see the indentation where the heart should be in that picture on page 409. I think we don't have a picture of it on the PowerPoint, but hopefully you guys can see that and see what I'm referring to. So the right lung has 3 lobes and the left lung has 2 lobes. And that is why, because of the position of the heart. And I mentioned that we would refer to the pleura. The pleura, very, very important for the assistance of, making sure that the lungs are protected in the process of breathing so that, again, the lungs themselves are not being damaged, rubbing up against the wall of our thoracic cavity. So the parietal pleura, we labeled as number 20 on our diagram. So if you haven't had a chance to spell that out yet, I'm sorry I didn't spell that for you guys. I realized I didn't do that. But the parietal pleura was number 20 and the visceral pleura was number 21. Again, they're both pleura that just mean membrane. So in this picture here, you're seeing the red as the parietal pleura and the blue is the visceral. They're both just simply membranes. And again, the parietal is the one on the outside and then the visceral that actually sits right on top of the lungs themselves. And then there's the interpleural space. You can see that on the, outside this lung here. There's just a little space. There's actually going to be a fluid that's created that's going to help to act as a lubricant in this process of breathing to help ease that friction. And that's exactly what you'll see here, that the interpleural space is where that serous fluid is going to be put right in there. So that's the interpleural space. Like I said, its job is to help ease friction as our lungs are expanding and then contracting. That helps with that process. The very similar we have in our joints. If you guys remember in our synovial joints, we talked a little bit about how synovial fluid within our joints helps when my fingers are moving around or in any of those joints, my knee or elbow or what have you, helps so that my bones aren't rubbing up against each other. It's a very similar process here to keep everything protected. So that serous fluid helps, in that process, and there's a certain amount that's constantly being produced. Sometimes we produce too much, and that's where we see the term pleural effusion. That's going to, again, just mean that our body has created too much fluid and can cause a buildup in that cavity. Whereas if that fluid then becomes purulent, which means it's more of a pus-like fluid instead of its normal water-like substance. Hyperemia is that disorder that's referred to as that too much fluid that has then developed into kind of a pus-like fluid. So if you ever see those terms, that's what that means. But again, on a normal, healthy fluid, again, we're always trying to maintain that homeostasis. We normally are just producing the amount that we need. But that's what that is. I would be familiar with serous fluid that's going to be produced and pushed into that interpleural space. Okay. So normal lung expansion depends on opposing forces. So what I mean by that, this is referred to, you guys will see this on page 412, and we'll talk a little bit more about it. Well, it talks about it actually on page 411. But there's two opposing, or two factors that oppose lung expansion. What that means is, here's why our lungs will expand. And not expand too much, and just to what they need. We have what's called elastic recoil of our lungs. A great way to think about this is, and the analogy that they give in your textbook on the next page, on page 412, is looking at a balloon. We know that we inflate a balloon. It will inflate if we blow a bunch of air into it. It will inflate, but then once we let that go, if we don't tie it off, that it will immediately, let all that air out and become smaller again. I could then blow the balloon back up, but as soon as I let go, it's going to get smaller again because all the air is going to rush out. And it will do that over and over and over again until I, wear that balloon out and eventually pop it, I guess. But that's what elastic recoil is. The balloon, because of the fibers of the balloon and the material that it's made up of, it is designed that way, that it can expand, but then in the process of air being able to come out, it's not going to stay in the expanded state. It's going to instead, go back to normal. It's going to go back to that deflated look where it gets a lot smaller. The lungs are very, very similar. That when we breathe air in and fill our lungs with oxygen and air, the lungs will expand. But then we have this elastic recoil where my lungs will be able to go back to normal. So that's what it means by elastic recoil. That's what that is referred to as. And then surface tension, a lung also has the ability to collapse because of what's called surface tension. I'm going to show you guys, I think we actually talked, the picture. Oh, this is the elastic recoil that I was just explaining to you guys. The elastic recoil, so a lung and a balloon want to always return to its unstretched shape, and that is because of the arrangement of the fibers that make up the lung and very similarly a balloon. Now, surface tension, they're actually showing you guys this in that bottom picture down here, that inside of an alveolus, we have these water molecules inside. It's, as it mentions on the next slide here, water has a high surface tension because water molecules are made up of, and I don't want to get too chemistry because we skipped over that chapter and I know we didn't cover that. But what happens is they're made up of positive and negative ends, and opposites attract in chemistry, that positive ends are attracted to negative ends, and that's what it's showing you here. So they're likely to kind of pull. Surfactants are things that interfere with that surface tension, and that will in turn help that alveolus to stay open. And that's just something our body naturally will create, and over time we are, you know, in the case of maybe diseases that may be affected, but that will help, you know, keep our alveolus from, you know, collapsing on itself, I should say. So these are reasons why our lungs have the ability to expand and then go back to normal. Mostly the elastic recoil is something I would be familiar with. The surface tension I know can be kind of confusing, that our alveolar cells are going to help to decrease that surface tension, and I think that gets to chemistry, and I know we didn't cover that too much, so I wouldn't worry too much about the surface tension. Whereas then this kind of does the same thing, and I wouldn't stress too much about this, but your book gives this great analogy and shows this picture and what you're seeing on the bottom of your PowerPoint here. But the lungs have the ability to expand because of what's called negative interpleural pressure. That has the ability to overcome elastic recoil and surface tension, so that's what gives it its ability to expand. Our elastic recoil allows the lungs to go back to normal, but then we breathe that air in, that's what allows it to expand. Because as you can see here in this diagram, we have the pressure in our atmosphere is labeled as P1. P2 is what's inside the lungs, so we refer to that as intrapulmonic pressure. And then in that pleural space, that's that interpleural pressure. And interpleural pressure is normally negative. And that's what keeps that, you know, lungs at a normal, you know, size. In the event that something happens to that membrane, to that pleural membrane, so showing a hole here in this picture, will allow air to rush in and will actually collapse that lung, making the interpleural pressure now more positive, and it pushes on the lung itself, and that's what causes the collapsed lung. And lung, you know, your right lobe of your lung is separate from the left lobe of the lung, so notice that nothing happens over here in the event that there's damage to one. That our bodies were designed that way so that any damage to one we're okay with the other one. And it shows that in the event that we remove air and make that pressure negative again, that's how then the lung will then start to expand again, because we need that interpleural pressure to be negative. So that's what that shows, is loss of negative interpleural pressure will collapse the lung will expand if that negative pressure is restored again. So that's showing you that if we take a pump in that hole and actually pump air out of that pleural space, then it's going to show that that lung will go back to normal. So very similarly, a knife wound to the chest will then cause that, so meaning any damage to not just the pleural space here, but also to the lung itself is going to cause that air to rush out, and we need that interpleural space to be negative. So we don't want any air going into that pleural space. So that just shows a couple clinical examples here. So a knife to the pleural space or rupture in the lung itself. Okay, so again, don't stress too much about that, but that helps to understand why the lungs can then expand. So compliance is a measure of our lungs' elastic recoil. When compliance decreases, the lungs are going to be more difficult to inflate. So in the event of pulmonary edema, any type of respiratory distress syndrome or pulmonary fibrosis, those are where we're seeing examples of a decreased compliance. And so with the lungs being less difficult to inflate, we're getting less air into our lungs. If lungs are therefore too stretchy, so thinking about if that elastic recoil, you know, maybe over time, if it becomes kind of loose, thinking about a balloon that may be blown up a whole bunch, you know, and we've just really kind of stretched it out a whole bunch, it is going to be easier to expand than it would be the compliance of a balloon that has never been blown up before is probably really, really tight. So that's an example of maybe when compliance has decreased, we don't have that, that that with that stretchiness to it, that's very compliant. So that compliance is decreased. Whereas if it's too stretchy, then it may be able to inflate very well, but it cannot expel air on exhalation. So you might see then a barrel chest syndrome. And I think your book has a picture of barrel chest and what that looks like on page 414. So you can see a patient who is displaying barrel chest may have their elastic recoil might be too stretchy. Okay, so that's what compliance is. Compliance, I would definitely be familiar with just what compliance is, how it's that measure of that elastic recoil. All right, guys, so I'm actually going to stop the video here and take a break for just a second, so you guys can have this in 2 parts, because you guys can move right on to the next one, but I think it makes it easier to see that we focus on the anatomy of the respiratory system, and then we'll get into a little bit more in the second part. We'll get into some more reasons as to why air moves in and out of our lungs, and that's what we'll end with. All right, guys, so I'll end this video here, but you guys go ahead and move on to the next one.